Hello, everyone. Dr. Jack Wolfson here. Welcome to tonight's presentation. I'll be bringing on my close friend, Dr. Keith Smigiel, who's a partner with me at Natural Heart Doctor. I'll bring him on in a little bit. I'm going to carry some of the weight in the beginning, and then he'll come in really for the conversations as it really relates to some of these more intensive biohacks. The chat box is open, so jump into the chat box. You can feel free to say hello and where you're from. You can put comments in there. Dr. Smigiel and I will be addressing things in a Q&A at the end of the presentation. We're not going to really be monitoring what's going on in the chat box again until the end. You can ask messages in the chat. You can also do a private Q&A question as well. And I think you're going to get a lot of information about this, and we're just really excited to present this to you. A little bit of housekeeping. We'll probably go for about 35 minutes with additional time for Q&A. May go a little bit longer than the 35 minutes, and we'll try and wrap it up within an hour. Don't worry, because the replay is automatically available after the presentation, and we will send you out an email tomorrow with the replay on that as well. Now, I also have a line here that says download this document, and we'll send out the document tomorrow. But right now, I'm going to do what's called share. I'm sharing a document with you, and it is just a short form version of what we're going to be talking about tonight. Just kind of some of the bullet points, and then next steps should you choose to take any of those. So if you click on that, you get that file. It'll be downloaded to you. We will also email that out for you tomorrow. If you have any questions, certainly you can email us as a company at health@naturalheartdoctor.com. And again, we'll also be giving out Dr. Keith Smigiel's email at the end of this presentation for those who are interested in taking action on working with Dr. Smigiel for cardiac longevity. And ultimately, there may be some technical issues, with the presentation. I talk fast, but please don't stress. I think Dr. Smigiel would agree that stress is bad for longevity, so we don't want people stressing out. That is for sure. So please do not stress on this whatsoever. And again, thank you so much, for being here. We actually have around 2,000 people who signed up for this webinar. Now, when we talk about longevity, what is our limit? What is our limit to longevity? Well, I will say this, and some people, they have concern, they have a limit to where we're at. But listen, Noah from Noah's Ark lived until 950. I like to trot that out as an example for all doubters. But I also like to say that if you're living like this guy, who is, Tom Hanks in the movie Castaway. So Tom Hanks, he's on the remote island after a plane crash. And on the plane crash, he lives on the island. He goes to sleep with the sun down. He awakes before the sunrise. He watches the sunrise. And then he spends the day in and out of the sun, and he's wearing a loincloth. He's eating coconuts, fish, and avocados. There's no chemicals or pollutants or toxins that are there. Only thing he suffers from, which is a serious issue, and we'll talk about this in our methodology, he suffers from loneliness. He's lonely. And that obviously is a problem when you don't have a community, you don't have other people. Social isolation is not good. We don't want that. But my intention of telling you this story about this particular movie is that if we all lived on this island with our family and friends, going to sleep with the sun down, spending time in the sun, eating these healthy organic foods, staying away from the toxins, being physically active, we live until we're well over 100. The only thing that we would die from would be trauma. Yes, it could be food starvation, but it would be trauma. Otherwise, why would this person die? Why would they have a heart attack? Why would they have a stroke? Why would they have cancer? Why would they have movement disorders? These are all man-made diseases. It's not your genetics. I want you to understand this, people, and you can repeat this mantra out loud right now. Say it, because I'm going to say it. I'm Dr. Jack Wolfson. My genetics are perfect. My genetics are perfect. Yes, I have a family history of coronary artery disease. My grandfather, I have a family history, I guess, of COPD. My grandmother was a smoker, so I guess it's family history. I don't smoke, of course. My father died of a rare neurologic condition called progressive supranuclear palsy. And I'm not going to have that either, because although family history is true, it's only true if you eat, live, and think like your family members. So if the goal is to live differently than your family and eat differently than your family, you can expect a different health outcome. Your genetics are perfect. We can run and jump and see and feel and make babies. It's not a genetic problem. It's not a genetic problem. Okay, now here's one major thing that really bothers me, and a lot of you have seen this slide before. Since 1980, we have gained 3 years of longevity. 3 years of longevity since 1980. Now, since 1980, we've seen the explosion of coronary artery bypass surgery, angioplasty, stents, ablations. That's just for cardiac. We also have clot busters for acute strokes. We've got a gazillion different pharmaceuticals now that exist that weren't around in 1980. But with all of this technology and all of this pharmaceutical spend, we've got an extra 3 years. That's embarrassing. And if you're here and you're happy with the life expectancy of an American male of mid-70s and female of late 70s, if you're happy with that, then you probably don't belong on this webinar. You know, if you're like, well, cool, I mean, what's the last several years of your life like? Is it arthritic and in pain? Is it cognitive issues? Is it constantly going to the doctor and back and forth? Is it fatigue? Is it low libido? Is it erectile dysfunction? Is it just not the life you're looking for? Because nobody wants the 100-year heart. If the last many years of your life, you're miserable, you're not able to do the stuff you want to do. All right. So I'll ask you, what are your goals and what are your dreams? What do you want to accomplish? Maybe it's travel. Trip to Europe, trip to Asia, Hawaii, Central America, whatever it may be. Maybe it's to dance at your grandchild's wedding. Maybe it's to pick up pickleball or, stay active golfing, active with the grandkids, mountain biking. Maybe your goal and dream is to have better libido, better sex life, better, sexual function, which is really important. And people who are sexually active, as they get older, they live longer. They do. Or maybe it's an aesthetic thing. Maybe you just want to look younger. You want to age in a more youthful way. And that is very important, because I'm not here to say that everybody should go out and get plastic surgery. That's for sure. That's for sure. What I am here to say is that when you eat, live, and think in a healthier way, your aesthetics look better. You feel better about yourself, which helps you live longer and live better because you're happier. Okay. Now, me personally, my goals, I want to live long, but I want to live well. I don't want to die like my father did at 63. And the last 6 years of his life were mentally and physically horrible. And it just got worse and worse and worse. And Mayo Clinic could do nothing about it. Nothing about it. All right. A little bit about me real quick. I've been a cardiologist since 2002, did all my training in Chicago, moved out to Arizona in 2002 and joined the biggest cardiology group in the state of Arizona, senior partner there. I would meet Dr. Keith Smigiel at around that time with his wife and his 2 children. I was the director of cardiology and cardiac rehab in 2011. My peers voted me one of Arizona's top doctors. I'm the founder, of course, of Natural Heart Doctor, the worldwide leader in cardiovascular health, top 50 functional medicine doctor, author of the book, The Paleocardiologist, and a chapter in the Integrative Cardiology textbook. And in person, I've seen over 100,000 patient interactions and, of course, millions of people worldwide. And in a little bit, you're going to meet my good friend, Dr. Keith Smigiel, who will, maybe if we have time for it, he'll delve into some of the benefits of his therapies on hair. He has not touched my hair. I'm confident with my hair. I'm happy. But Dr. Smigiel naturally has a beautiful head of Italian hair, and he's going to talk a lot about some of the therapies that he's doing. Dr. Keith Smigiel is a doctor of chiropractic. First and foremost, and then he understood the value of a lot of these procedures as it relates to anti-aging, and these are procedures that are injections of things like exosomes or stem cells, also things like IV ozone, so we'll talk about that in a little bit. And then here's Dr. Smigiel and I actually, this past summer, we went with our boys to Whistler, British Columbia, and here we are mountain biking, and this is a passion of ours. We're both in our mid-50s, and this is the kind of stuff that we want to do with our children. Dr. Smigiel has 2 children. Sophie is 20, and Lars is 17, and Lars went with us, and my 2 boys, and that's what it's all about. It's about staying young enough to be able to do these activities. So we're talking about thrive, not just survive. And this is the anti-aging longevity in Yeshua as our Savior. That is the eternal heart plan. And we will in this presentation, focus mostly on the 100-year earthly hearts, and maybe shelve the eternal for another discussion. That's not my area of expertise, although I'm learning as much as I can. In any case, the 100-year heart method, this is what we're talking about, thrival nutrition. Remember that word thrival is a combination, or in French, they come up with a word, it's called a portmanteau, and the portmanteau is the combination of 2 words, thrive and survive. Thrival nutrition, thrival lifestyle, thrival ultra diagnostics, and then thrival biohacking. And then we're going to talk extensively about the biohacking. If you know me, I'm a major proponent of seafood. I think seafood is the healthiest food in the world. We can talk about toxins, we can talk about metals, we can talk about whatever you want to talk about. The reality is, according to most studies that look at this, the seafood eaters are the longest lived, including the famous group of people, the Seventh-day Adventists in California. The people who live the longest there are the women who eat seafood. So you look at hundreds of thousands of people in these studies, it is all about the seafood. The next thing, is that this is another study here, where we get actually in the same study. What they found is that seafood eaters, not only do they live longer, but less cancer, less dementia, and less infection/pneumonia risk. Now, this is a study that, again, you hear so many talking heads on television, but this is about pasture-raised meats, in my opinion. But this study from the International Journal of General Medicine said total meat intake is associated with life expectancy in 175 different populations. The more meat you ate, the longer you lived. I'm not talking about soft markers like cholesterol, LDLs. I'm talking about something that really matters, not blood work, living longer. And can you imagine if you eat pasture-raised, free-range, healthiest animal products, which is all I eat. That is all that I eat when you know me. So meat is on the menu, organic food, right? So if you have a lot of exposure to pesticides, that's a surefire way of dying early. So seafood, pasture-raised meats, organic food, clean water, of course, quality water, and intermittent fasting. And each one of these guys is its own lecture, okay? Each one of this stuff is its own lecture. All right. I do like to talk about coffee. If you know me, I'm a big coffee fan, and the data on coffee is very impressive. Here's 3 studies here. Impact of coffee intake on human aging. This is from December of 2024. And talks about the benefits of drinking coffee as an anti-aging. The European Journal of Preventive Cardiology. Coffee drinkers, less heart attacks, less strokes, less heart rhythm problems, and they live longer. And then this most recent study from January of 2025. Coffee drinkers of about, the sweet spot was 3 to 4 cups of coffee in the morning had the lowest risk of dying. And that's pretty much what I do. I would say I average about 3 to 4 cups of coffee in the morning. But remember, this is on just regular coffee. So can you imagine what you do with the quality coffee that I sell at cardiologycoffee.com? It is expensive. It's an investment. It's an organic, mold mycotoxin-free, glyphosate-free coffee. You can drink something different, or you can drink this. My intention is to give you the information. Cindy, decaf is not as well studied as regular, but I believe that a quality organic decaf brewed with the Swiss Mountain decaf process is pretty darn close. I think that there is some medicinal value to these natural sources of caffeine. But, and I'm not encouraging people to drink coffee if they're not coffee drinkers. We'll talk about other strategies that can help. But if you're a coffee drinker, make sure you drink the good stuff. And if all you can tolerate is the decaf, that's fine too. All right, I'm not going to spend too much time here, but I talked about this when I mentioned Tom Hanks in the movie Castaway. Thrival lifestyle, sleep, sunshine, movement, avoiding toxins, chiropractic care. If you sleep well, you live longer. That's obvious. If you get sunshine, you live longer. We all know that. If you move more as opposed to being sedentary, you live longer. These are common sense things. The more you move, walk, hike, bike, push-ups, pull-ups, squats, lunges, building muscle mass, the longer you live. And this toxin category is monumental, for sure. But it's also about the thrival mindset. So it's one thing to do the eating the right foods and avoiding the wrong foods. And it's another thing to get sleep and sunshine and movement and avoiding toxins. All those are important. But the thrival mindset is just as important, and maybe even more so. Having that sense of purpose. What is my purpose? I want to end the fact that cardiovascular disease is the #1 killer worldwide. So my purpose is to provide people with health and wellness information, testing, supplements, whatever, consultations in order to live their best and longest life. Now, my purpose is also to be a man of God. It's also to be a husband and a father and a friend and a steward of the environment. But I have a lot of gratitude for what I have. Gratitude for my experience with my father, of how my father would die of a Parkinson's-like illness, but it created the man that I am today, the doctor that I am today. And I also have self-acceptance. I haven't been perfect my entire life, that's for sure. That's for sure. No human has been perfect. But I accept my faults. I accept who I am. And I move forward, and so should you. Community is another thing that's critically important as well. Finding your tribe. And hopefully all of you here are part of the Natural Heart Doctor tribe. We're here together. Many of you I consider friends. I mean, people who I've met before, people who I've contacted over the internet before, on Zoom before, by phone before, or even in conversations here in text messaging. So friends, family, community, critically important. As I mentioned earlier, social isolation is a recipe for disaster. Recipe for disaster. But it's faith-based. People who have God in their life live longer and live better. Through many studies, the power of prayer, the community associated maybe with going to a church, a synagogue, a place of worship. Very important, okay? All right. Thrival Ultra Diagnostics. Ultra Diagnostics is the most advanced testing in the world. It's not an EKG, although EKGs can be useful. It's not about basic cholesterol levels, which is not useful. It's not about CT scans or stress tests, which stress testing has a purpose if you're having symptoms, chest pain, shortness of breath. CT scans for preventive have no role at all. Okay? Thrival Ultra Diagnostics, though, is about doing advanced cardiac testing, micronutrient testing, leaky gut testing, toxin panels, and that's what we do there. And that is also available in your download where we talk about that. The thrival biohacking component has two components. One is the supplements part of the biohack, things that I talk about a lot: wild salmon roe, emu oil, oral phosphatidylcholine, and shilajit tar, things like that. And there's many other that are there. But I want to dive into right now, this is the data on wild salmon roe. If you look at all the vitamins, minerals, protein, fats in this product, it's absolutely incredible. And again, that is in your download. I think this and Kickstart My Heart is our two single greatest products. But I want to talk to you about the thrival biohacking component. So Dr. Keith Smigiel, if you want to join us at this time. There we go. There he is, Dr. Keith Smigiel.
Hey, Dr. Jack.
All right, so we're going to talk about thrival biohacking, and this is certainly, all the other stuff. You've been teaching this stuff, frankly, that I just mentioned before I ever started even talking about that. You've been a doctor of chiropractic, since the 90s. You were talking about all these things before I was. But I think that, what you certainly did is, through your own health challenges, you've kind of, you became a chiropractor because nobody could help with your health challenges from an injury. And then again, you had subsequent issues that led you into this biohacking space. So maybe take a little bit, if you want, do like a little intro, and then we can dive into this, some of these biohacks that we're talking about.
Absolutely. Hello, everyone. My name is Dr. Smigiel. I'll keep this short, but basically in high school, I injured my neck. I was put in the hospital, and I put in traction medication. I wasn't getting better, and my dad finally took me to a chiropractor. I was 16 years old. I was in a neck brace, and chiropractic got me out of the hospital, got me out of my neck brace, and got me healthy. So I graduated chiropractic school in '96. I still am a chiropractor, but I practiced chiropractic exclusively up till 2017. But in 2012, I injured my low back really bad as a chiropractor. In bed 3 days, couldn't move, had all my buddies coming over trying to adjust me, and I was in bad shape. Herniated disc, surgical candidate. I found a regenerative medicine doctor through a friend, and they started doing these injections on me. I knew nothing about it, but I was desperate. Within 3 days, I was better. I was back into practice, and just like my experience as a teenager, getting hurt with my neck, and that drove me to become a chiropractor. I'm a intuitive. I feel more spiritual person. I felt I was being guided that I needed to do this for my patients. So I went back to school for 5 years to get my medical license, not to practice medicine, but to do regenerative therapies. So along that pathway, I discovered, many things about regenerative medicine or, the biohacking space. I really don't consider myself a biohacker, but more of, like the longevity, regenerative, kind of more natural procedures that are available to just kind of enhance your quality of life and maybe increase your longevity. So we're talking about sauna, cold plunge. These are things you could do at home. I cold plunge every morning. I sauna 3 days a week. And I do this not to, some people do it to kind of lose weight. I do it for dopamine. It makes me feel real good. I work hard. Dr. Jack and I both work hard at Natural Heart Doctor. And, it just kind of builds up my dopamine levels and I just feel great. I mean, I don't enjoy going to cold plunge, but the effects, and I've been doing it for 2 years. It's incredible. The sauna, I typically do more on the weekends because I do the hot and cold plunging. Let's go back, Jack, and that. Oh, you got that. Okay, use lifestyle. All right. EBOO and exosomes. We'll get that in a few slides. Go ahead, Jack. You can move forward. Sauna can help with like heat shock proteins, which again can help your metabolism. It's a good detoxifier. People have been doing sauna for thousands of years. Go to the next slide. Cold plunging, I think I already explained this. Cold shock proteins, brown fat, that helps you develop more brown fat, which can increase your metabolism and help you detox even more. But again, my purpose, my specific reason for doing it is for the dopamine release and, just putting me in a good solid mood for a long period of time. Next slide here. Maybe Jack, you could cover this one.
Yeah, red light therapy, nothing replaces the sun, but red light therapy is another biohack that a lot of people use, a lot of people talk about. People can purchase this equipment on their own. There is some good data, essentially, where the red light goes in to the mitochondria and helps assist with mitochondrial function. It's just kind of like this energy source coming in. The best source of energy, of course, is coming from the sun. But for people who live in colder climates, this is another option. There's red light therapies that people are doing on their scalp, to make hair grow, on their face, for aesthetics. We can shine red light directly into your heart. We can use laser for red light to go into your heart. A lot of different things that can be used. And, Dr. Keith and I, we both were at the American Academy of Anti-Aging in Las Vegas, the biggest health-related event in the world, and there's red light beds all over the place. You can buy them personally. You can also go to centers that have red light therapy. It's not something that we've chosen to do at Natural Heart Doctor Scottsdale, but I did want to mention that this is an evidence-based biohack that people can use, and probably maybe, even for people with heart failure inflammation, oxidative stress. There's red light therapy that people can do. Another one of my favorites is IV phosphatidylcholine. There's oral PC, which is very beneficial. And then when you come out to Arizona, or if you're in Arizona, Dr. Smigiel and the team there can give IV phosphatidylcholine. And the whole importance there is about kind of replacing the cell membranes. If you look at the picture on the screen right there, that one thing I want to point out is that there's these red squiggles. Let me say this. The cell membrane is the fence that surrounds every cell. And that cell membrane or that fence is responsible for keeping things inside the cell that belong, outside the cell that don't belong, the way cells communicate with each other, the way cells receive hormones, vitamin D, on and on and on. And a good cell membrane is key, but as we get older, it just becomes damaged. So when we eat seafood, we replace this. When we eat eggs, we replace this. When we eat free-range grass-fed meats, we replace this. But another strategy is oral phosphatidylcholine that we sell, and then the other is through IV. Now, I mentioned that cholesterol is part of the cell membrane. That's in the red squiggles. But all of those yellow extensions, every one of them is these phosphatidylcholine phospholipid molecules that need to be replaced. Otherwise, they're just old and dangerous, etc. There's some great questions coming in, Jim, about methylene blue. I'll let Dr. Smigiel answer that in a little bit. We'll come back to that. All right. This is where things start to get even more and more interesting, where we get into what's called EBOO, okay, or IV ozone therapy. And this is an example of how it looks. And this, again, is where we start getting into a significant investment in your health. I want to preface this by saying that, yes, cold plunge can cost money when you buy your own thing, and, saunas cost money. And somebody asked about hyperbaric. It's another, technology that can be used. At the event that Dr. Smigiel and I went to, and I've been there for several years, they're selling $125,000 red light beds. But this opportunity is very interesting. I want to let the expert, Dr. Keith Smigiel here. Dr. Smigiel, you talk about EBOO and what's going on with this.
Yeah, so ozone, I've been using ozone in my practice since 2017. And during the pandemic, I saw the true benefits of giving patients ozone. I treated a lot of patients that were really sick with COVID, and I pretty much brought them back to life using just ozone, old school way of administering ozone. I would basically draw blood from a patient, put it in an IV bag, and then put ozone into that IV bag. We do about 100 cc's of blood. So the benefits of ozone is it kills viruses, it kills parasites, bacteria, but most importantly, it stimulates your mitochondria. So now we have technology called EBOO, extracorporeal blood oxygen therapy, and it's a machine that we use dialysis technology that we could do large amounts of blood volume, like 2.5 liters of 5 liters of your blood. So instead of 100 cc's using the old school way, we're using 2,500 cc's of your blood, and we're just kind of super oxygenating you on an intracellular level. So what the ozone does, it reduces your inflammation, it reduces oxidative stress, but most importantly is that mitochondrial stimulation, getting your cells to work better naturally. It does cross the blood-brain barrier. It increases blood flow to your brain, and I've seen EBOO help a lot of patients along with the other therapies that we're doing in the clinic. So after we administer the ozone, we pass it through light therapy. Light therapy also has similar effects to ozone in your blood, so it can kill bacteria, parasites, mold, viruses, and also stimulate your mitochondria. And what we've been doing for the past 6 months is including methylene blue with that procedure for some patients, because methylene blue can enhance your mitochondria also. And the EBOO machine has a built-in UVI light that we can activate the methylene blue during that treatment. So, I formulated a really good protocol for these patients that, are having some issues or just want longevity. But, a lot of the longevity treatments are the same treatments that patients are getting when they're sick too. But we're just finding out, these treatments are not just helping people that are suffering, but we're also increasing quality of life of people like yourself that are into health, want a little bit of an edge. They're dealing with, stress in their job, lifestyle, work, environmental toxins, and we can just kind of help you out a bit with doing these procedures, especially EBOO. So, we've had some fantastic results with Dr. Wilson's referrals for cardiovascular patients too. But again, it's not a standalone treatment. We're combining these treatments with other protocols that Dr. Wolf recommends for you guys, and then we add these other services with that. So,
is there any patients who would not be a candidate for EBOO? Like, is there any particular condition? I've never billed ourselves, of course, as a cancer institution. There are other places to go if you're dealing with cancer. But are there any cardiac patients? I mean, obviously, listen, you're there with them during the entire thing.
Right.
So we've dealt with a lot of people with severe congestive heart failure, cardiomyopathy, people who were fresh out of a heart attack, fresh out of a stroke. We're doing this on people to avoid ablations or make them the healthiest version of themselves before ablations. So anything, is there anybody who wouldn't be a candidate for EBOO?
Some patients that may have, or high amounts of anticoagulants, we usually have them either slow them down if they can, or maybe stop them. But no, there's really no contraindications for EBOO. The biggest issue we have with this procedure is the patients that typically have poor vein access. If they have poor vein access, this treatment cannot be performed. And it's a small percentage of patients, but every once in a while we come across one because we need to access, a vein in both arms, and it needs to be, pretty profound blood flow to really get this device to work properly. So no, we haven't run into any issues with contraindications, but it's a safe procedure. It does take about an hour and 20 minutes to do. And patients always ask, well, how many treatments do I need? It just really depends on the case, what the patient's looking for. But I mean, if you can get one a year, that'd be fantastic. But typically we're seeing patients that have conditions. So we try to run a protocol of one treatment a week for 4 weeks. I know it sounds like a lot, but if someone's really suffering and their health is really challenged, this can really snap them out of it. And, we're seeing good results with the EBOO technology.
All right. And just so you all know, Dr. Smigiel is an amazing stick. He's actually done IVs on me and blood draws on me. And I feel very, very, very confident in his skills, with that. So again, EBOO is perfect for anybody and everybody. These are some of the conditions, right? Coronary artery disease, after a heart attack, after a stroke. If you got concerns about cholesterol, markers of inflammation, stress. Somebody asked about Parkinson's. This is phenomenal. The things that we're talking about here, these biohacks for Parkinson's. My father with PSP, I wish, of course, that he had the opportunity to get some of these erectile, dysfunction, sexual dysfunction, people with toxins, people who are mold toxic. Again, a lot of people are doing this. And as Dr. Smigiel, said, you can come out to Arizona, where Dr. Smigiel is located in Scottsdale, and you can do this in our Natural Heart Doctor office in Scottsdale. And it's you can try and find someone local to you. I mean, other people are doing this. We feel very confident about our abilities at Natural Heart Doctor, at least even for your first session. If you want to come in from out of town, we have a lot of people who travel to see Dr. Smigiel, and of course myself and the rest of the team, in Scottsdale. On average, when you're searching around, you can expect to pay $1,500 to $2,000 per session, depending on your situation. And when you do a consultation with Dr. Smigiel, then we could talk about kind of like what the strategy is. If you're like, hey, I'm in my 50s, I feel great, I want to continue to feel great, well then, yeah, it may be something that it's, as Dr. Smigiel mentioned, once a year, once every 6 months, every 3 months. We're not going to really overdose on this. It's really just a matter of, like anything in life, two things: the desire to put in the time, and then the desire to invest in this particular thing. And I also want to mention at this point that I want all of you to know about these technologies, and I want you to hear of it from us. What I don't like is when someone comes to me, it doesn't make me feel good, and they say, what about this? I heard about this from someone else. And then I say, well, I didn't offer that to you because I didn't think you'd want it. I didn't think you'd want to spend the time. I don't think you'd want to invest in it. You know, you're retired, you're not, you don't have a current income or whatever it may be. So I didn't offer it to you. I don't pass that judgment on people. My intention and Dr. Smigiel's intention is to give you all of the information, and then you decide if you want to do it. Luckily, it is a free country for the most part, and you can decide whether or not this is for you. But we do understand that these are advanced therapies that may not be for everyone based on your desire and based on your budget, but these technologies are available, and I wanted everyone to know about it. But I also wanted everyone to know the foundational stuff first, and that's why I spent so much time talking about the foundation. I could have just jumped, Dr. Smigiel and I could have jumped in and started talking about EBOO and the stuff that we're going to talk about next, but I must reiterate the foundation. Okay. There is also something, Dr. Smigiel, right, that you do, and you've done this many, many, many times and successfully on many of my patients.
Yeah.
But tell us what the P shot is.
So the P shot is for men, and the O shot is for women. The P shot is for patients that they don't necessarily have to have erectile dysfunction. They can have lack of performance. So your penis has blood vessels, nerves, and it also has a sponge-like tissue. And as we age, sometimes the vessels in the penis don't get enough blood flow, and they can actually kind of scar down a bit. So there's some technologies out there we can kind of break up that scar tissue using a shockwave device. But then we also infiltrate a growth factor to stimulate neurogenesis, angiogenesis, the production of new cells for that spongiosum tissue that makes your penis larger as it gets filled with blood. So patients don't have to have ED. I see a lot of patients just want increased performance, and as you spoke about that in the beginning of your presentation, how important a good sex life is for health and longevity. So that's why we offer the P shot. It's we can use platelet therapy, which we harvest from the patient from their blood, or we can use a stem cell like an exosome, which works even better because the growth factors are younger. So along with a proper diet, exercise, the P shot can really enhance your sexual performance. And for women, we have the O shot. We're also using PRP or using exosomes. But what I've seen with the O shot for women is increased libido, lubrication, but most importantly is like incontinence, especially after the childbirth. Women typically have some sort of incontinence issue. And some women develop something called lichen sclerosis. It's an autoimmune disease, and it's not really treatable, but we've seen results with the O shot. We make these procedures as comfortable as possible, but they are effective. And if you want more information, you can reach out to me about these two procedures.
All right, and just because we want to be upfront with what the stuff costs. When you get the P shot, the O shot, it may be a one and done, depending on your situation. It may be something that you do more often. Would you say, Dr. Smigiel? And we're talking about, you could do these therapies in combination, and when people have a consultation with you, you'll obviously be able to dive into what the best plan is, and you come up with the game plan for the people. What you want them to do, how often it'll need to be done, kind of give them a menu of options, and then it'll be up to the individual person, right. Just like you're going into a restaurant and say, again, what works for you, what doesn't work for you.
If you got an EBOO treatment before the O shot or a P shot, it's just going to work better because your blood has been cleaned, you've been super oxygenated, your mitochondria is functioning, but you're right.
Got it. Okay, and then the final thing we'll talk about tonight is exosomes. And maybe walk us through this, because a lot of people have heard about stem cells. They travel, we've got a lot of people with cardiac issues who've traveled to, Panama, Central America, maybe Germany, places like that. But exosomes, I like to think about as like beyond stem cells. So maybe tell us a little bit about exosomes, what they are, and then we can get into the benefits of the exosomes.
So exosomes come from stem cells. Exosomes are microvessels. They're nano-sized. They continue to circulate around the body. So I've been using exosomes exclusively since 2018. You may have heard of like Wharton's jelly, mesenchymal stem cells. I like exosomes. They're super safe, super effective. I've done about 300 cases using exosomes, and I've had fantastic results. And the reason being is not just the standalone procedure, it's the combination of therapies that I'm doing along with the exosomes. The exosomes drop growth factor or signals for new tissue regeneration. Over the age of 25, when you have a tissue injury, a lot of times your body will lay down scar tissue, which is good, but it loses function. Scar tissue has minimal function. So what the exosomes do, it gives your body the chance to replace those unhealthy cells or like that scar tissue with tissue that has function, tendon, ligament, vascular, nerve, these types of things. So there are targeted injections for orthopedic issues, for low back pain, shoulder pain, knee pain that we use under ultrasound guidance. So we get your MRI, we can see that there's a tissue tear, and I'll infiltrate the exosomes into those tissues for potential regeneration. So you can avoid surgeries or pain. But basically, we also do IV infusions of exosomes. We have to use a lot more of these. For example, for an orthopedic procedure, we'll use like 50 billion, but for an IV, we'll use 400 billion. The reason being is these protocols come from Dr. Ian White, who I've been working with for the last 5 years with exosomes. And when you infiltrate these large boluses of exosomes, they continue to circulate around your body and work up till 12 weeks. And they do cross the blood-brain barrier. So I've had pretty interesting results using exosomes for cardiovascular patients, neurodegenerative disease, but site-specific for orthopedics. It's been incredible, especially these low back patients. My history of a chiropractor, being sensitive to low back pain, because that's what drove me into regenerative medicine. I have a fantastic protocol for patients that are suffering low back pain. Of course, go see your chiropractor, your PT, acupuncturist. But when those patients are just not successful, we introduce exosomes into those tissues around the spine. It works fantastic.
All right, so here's the kicker on this one. This is definitely going to be one of the most expensive programs that you would get into. It's the biggest investment, and other people charge various prices for this, but Dr. Smigiel is getting the products from Dr. Ian White. Someone had asked about published studies about exosomes. Pretty much all the studies that have been published about exosomes were done by Dr. Ian White, who Dr. Smigiel gets the purified product from. There's concerns with inferior products, as there always is. You get what you pay for. And not only is it not effective, but some of those are contaminated with something called lipopolysaccharides, which are actually the part of the cell wall of bacteria that are now into the infusion that actually leads to problems. And Dr. Smigiel is getting the best source that does not have lipopolysaccharides. This is not for everyone, people. It's not for everyone. If, again, if you're on a fixed income and stuff like that, eat well, live well, think well, do all those things. Spend your money first on food, avoiding toxins, whatever kind of movement and sunshine and holistic dentistry and seeing your chiropractor. These are, at the end of the game, called biohacks. And we want to do stuff like this if we can, before pharmaceuticals, before surgeries. We always want to kick surgery kick the can down the road as far as possible. And we think that this really helps for that. This is perfect for people, anti-aging, longevity, just as a tune-up, that's for sure. But as Dr. Smigiel mentioned, people with arthritic issues, tissue regeneration, people with back pain. This is fantastic for people with back pain issues where they don't want to undergo surgery. This is Dr. Smigiel started because of back pain, and now here we are because this therapy works. Any kind of cardiovascular issue, if you've had a heart attack, if you've had a stroke, cardiomyopathy, heart rhythm disorders, anyone will be a candidate for this. And then also people who have mild dementia, people who have tremors, Parkinson's features, Shy-Drager, Lewy body. There's all these different labels that the medical doctors give, but this is something that can be done. Dr. Smigiel, so we're looking at, as far as exosomes, sure, listen, you can get one round of therapy, see how you do, depending on your condition and depending on your desire and ability to invest in this, then you could invest more money and you could do these therapies more often. I guess in theory, right? The more often you do these things, the more likely you are to get the results that you desire.
Yeah. Again, it could be a one and done. The orthopedic exosome treatment is not as expensive because of the volume of exosomes that I use. So those are around 5,000. So just to let people know. So the longevity patients love the exosomes. So a typical protocol for a longevity patient is EBOO, methylene blue, maybe a P shot, maybe injecting the scalp to preserve hair, make it grow, and then of course an infusion of exosomes. That's a traditional, a typical longevity protocol that I do on patients, usually twice a year with those patients. Some patients just do it once, which is fine. So, but some of the patients that I treat, they have plenty of resources. They're well educated, and they invest their money in that. But they notice that the vitality, their quality of life increases. They continue to be active. They go on their long trips. They're doing their hobbies. Biking, running, pickleball is a big one. And they don't want to lose their cognitive ability too. So we know that these exosomes do cross blood-brain barrier, and you do help patients with neurodegenerative issues. And now, the more youthful appearance. So we do a procedure. We use a microneedle. And we put these exosomes on your face, and that's a pretty dramatic result because you'll notice that within 2 weeks how young and youthful and vibrant your skin looks because it is activating. Those growth factors are stimulating your collagen in your face, and we infiltrate those exosomes with a microneedle. And we talked about back pain, joint pain, arthritic complaints. My passion is the back, shoulder, knee. Just fantastic results. But it's not just the injections. There are other things that our patients are doing along with this because they may have lost function, and biomechanical assessments are important to make sure we can recover and capture their proper movements after these procedures. Heart function. I've seen patients with arrhythmias and low ejection fraction that we've seen to help. Again, we can't make any claims with these exosomes. The FDA doesn't allow us. But, in the clinic, we're seeing results. Improved sexual health. We talked about the P shot, O shot. But it is an investment. It does cost money. We buy these things, and there's different strategies we come up with, and it's usually patient specific. So in the initial consultation you'll have with me, we'll kind of uncover what's going on, what you're looking for, and then typically I put together a plan, and you kind of figure out, well, this is what I want to do. I want to do this first. I want to do all of it, and I try to be as upfront and as with the patient, saying this is what I'm recommending, and I recommend you do all of it. But if you choose not to, that's fine too. We got to start somewhere, and then once you get involved with longevity medicine, there's a lot of things you could do on your own, like we discussed in the beginning of the presentation. So you'll see a link here for my email address, but Dr. Wilson's also going to put up a link that you could schedule, a free 20-minute consultation if you have questions. And I'll do the best to answer those for you during that 20 minutes. Anything else, Jack?
Yeah, no. So the intention of this really is that for people who are going to schedule with Dr. Smigiel, he's not going to answer questions about nutrition or lifestyle. He's not going to answer your questions about should you get a sauna or not, or should you drink the Pellegrino water that Dr. Smigiel is drinking? Because the answer is you should. This free or complimentary call with Dr. Smigiel is if you're interested in either coming out to Arizona, or if you're in Arizona, about one of these procedures, whether it's IV phosphatidylcholine, it is EBOO, it is the P shot, O shot, or it's the exosomes. That's the intention here. Somebody made mention, and so you can click on the schedule a consultation. That'll take you directly to Dr. Smigiel's schedule. But I'm asking you to please be very respectful with this booking this time, because it's going to be about these advanced anti-aging strategies that are an investment. If you've got questions, you can always do a free discovery call with one of the coaches at Natural Heart Doctor. We got a lot of different things you can do, with that. But Dr. Smigiel is the anti-aging specialist at Natural Heart Doctor, and these are these advanced procedures that he does. So if you click on that schedule a consultation, it'll open up a new window, or you can email him directly to get more information on that. Somebody mentioned in the chat, are there any more affordable therapies? That's what we started off with, people, right? We started off with, these are the foods. This is the lifestyle. Sunshine, free. Sleep is free. Movement is free. Avoiding toxins tends to cost less money, right? Meditation, prayer, spirituality, community, right? That stuff is all free, and you need to do those things. Then you start getting into evidence-based supplements, which cost money. Testing can cost money, and these advanced biohacks. But like I said, my intention is to give you the information, and now you decide, should you want to, do any of these things. It is entirely up to you. So you can schedule that on there. All right, so Dr. Smigiel, let's talk about some of the questions that are in here. Okay, so someone is talking about inhaled ozone damaging the alveoli. So if there are some protocols actually to inhale ozone in a controlled manner. We're not talking about that. And this is something that's totally different, because this is intravenous. And the use of ozone has been used in Europe, and specifically in Germany, since the 1850s. There's rectal ozone, there's IV ozone. There's a lot of different things that people are doing.
Yeah, you don't want to breathe it in. It is irritant to the lungs. But when we do nasal ozone, I have patients hold their breath and I inject it up their nostril. I did that a lot during COVID to get some of the viruses out of their nose. But yeah, we're not breathing this stuff in.
Yeah, and again, even still, in like these lower amounts, and a lot of the way that I understand this is that it's what's called a hormetic effect, that you stress the system and the body reacts to that stressor in a positive way. Now, if you overstress the system, that's a problem. If you're breathing in massive amounts of ozone, that's not good. But some of these, milder amounts are, again, if you do an ozone suppository and you open up that capsule and you smell you'll smell the ozone, and there is therapy. I believe therapeutic value to that. Someone else, speaker is located. Dr. Smigiel is in the Natural Heart Doctor office in Scottsdale. So you come out to beautiful Scottsdale. We can tell you what hotels to stay at, what Airbnbs, what restaurants to go to, how it all works in our beautiful office in Scottsdale. Victoria mentioned, is EBOO effective for Parkinson's? The answer is definitively yes. You can get some great results, and Dr. Smigiel has worked with some of those people. Like I said, I wish my father was alive to get some of these therapies. Not when he was like overly advanced or like, right at the end. I'm not saying, that, but I think, listen, the more proactive and earlier we are, obviously that would be the best scenario. The best time to be healthy was when you were born, and the next best time is today, to kind of use that analogy as well. David said, is IV phosphatidylcholine a recommended treatment for erectile dysfunction? The answer there is definitely yes. Because whenever you replace those membranes, you're going to get better results. You're going to get healthier because of it. Elaine is saying, does EBOO help GCA? I'm going to assume GCA is giant cell arteritis. That is an autoimmune condition. Dr. Keith, EBOO is perfect for autoimmune.
Absolutely. Yeah, it's an immunomodulator.
Yeah, I mean, that's one of the things that you see, very easy, to see that. Victoria is asking, would the O shot work for a 90-year-old woman with a long history of incontinence? What say you, Dr. Keith?
I mean, it's worth, I don't want to be cliche about it, it's worth a shot.
Is there any downside, to that in that individual person?
No, I mean, no, we would do platelet therapy with her just to kind of see if we can get some results. And if we got results, then we kind of, the next procedure would be like a stem cell exosome procedure. Like a younger,
just depending on how especially if I would say this, the 90-year-old is a great candidate if the person otherwise has a good quality of life.
Right.
Like if the person is active and can has their own self-care and has a quality of life, then I think that this would be a therapy that somebody should look into. Cindy Barone is asking, do we get a percentage off for 2 of us if we do PRP? Listen, Cindy, our intention, of course, is to make things as affordable as possible. The cost on all these things, the equipment, the exosomes, it's monumental. And of course, all the training that Dr. Smigiel has gone through. Again, I've known Dr. Keith, for 20 years, and the guy's always traveling to get continuing education, the conferences that he goes to, the meetings that the both of us go to. But I'm sure that a package deal could be, if you come out with your spouse, I'm sure that there could be something that Dr. Smigiel could do, but I'll let him talk about that in a personal conversation. Let's see here. Joe is asking about hydrogen gas therapy. I believe you interviewed Ben Tameta. Very interesting. Go watch. That was inside of the summit that I did. I'll try and get more information and some more stuff about hydrogen gas, but he makes a good case for that. Kathy had mentioned about studies that are published about exosomes, and we're not going to find randomized double-blind placebo-controlled trials about exosomes versus conventional heart failure therapy, for example. But we do understand that there are many case reports. We have Dr. Keith Smigiel's personal experience, and there are published reviews in the medical literature. And I think as time, more and more is going to be available for that as well. Peg, do you have any therapies for fused cervical vertebra? How would some of these therapies work for someone who's had surgery on their neck?
It depends. I mean, a fused cervical procedure could have been successful and they have no pain. So it depends if the patient's having pain. If they're looking to increase range of motion, probably not much, but I would say if the patient's still having pain post-surgical, there's definitely some interventions we could do. I do a lot of these perineural injections that these nerves that get irritated, that give off pain signals. I use dextrose to hydrodissect any type of like scar tissue or fascial tissue that's adhered to these sensory nerves. And we use dextrose, which is, a very safe medication. It's a form of sugar, but it's shown to stop these pain receptors around these sensory nerves. But more importantly, it's a fix. It's not like putting lidocaine or a steroid in someone just to kind of hide the symptom for a while. But a lot of these patients that have chronic pain have peripheral nerve they're sensitized or they're entrapped in fascial tissue. And during all these orthopedic injections, I always include that with these protocols because I know how important it is to get these sensory nerves to kind of calm down and start to heal.
I think what you're hearing here, people, is that Dr. Smigiel, first and foremost, is a pain specialist. Yes, the anti-aging is great, and the cardiac longevity is great, and the vitality is great, but he started off as a pain and regenerative medicine specialist. So you can see, as he talks about these various pain issues, whether it's neck pain, back pain, about how these particular strategies are used and the combination of modalities that really make monumental benefit in so many people, you know, which is really exciting. Charles says, any recommendations to prepare for an ablation? Charles, before an ablation, we recommend you get optimized, right? So we want to make sure you're the best version of you before you go for an ablation, because that's how an ablation would be successful. If you have inflammation, if you have oxidative stress, if you have a lot of problems that we can see in the advanced blood work and all these environmental toxins, the ablation is not going to be successful for you in the long term. It's just not going to be. And the data really supports that. So Joe is telling me, get off the religious kick, will ya? And then Pam says, there's a lot of arguing going on in the chat box here. I guess I'll leave it with that. Enlarged prostate. Tell me about that, Dr. Keith.
So you can use ozone injections around the capsule. I don't do that procedure anymore. There are providers that I would recommend that if you have an enlarged prostate and an increased PSA. But, you know, doing the EBOO treatment. So now I'm doing more of a systemic ozone treatment. Am I targeting the prostate specifically? No, but it is a systemic treatment, and EBOO can you know, possibly assist with an enlarged prostate.
Yeah, the other thing I like is I like the ozone suppositories for that as well, because that goes into the rectum, and then just anterior to the rectum is the prostate. So can we diffuse some of that? There's a lot of different things we can help with enlarged prostate, berberine, optolipid. I mean, the whole idea of the enlarged prostate is that it's inflamed. So if we quiet down inflammation, oxidative stress, we're going to get some great results. Kathy, do you recommend chelation for coronary artery disease? I don't. We recommend improving the body's ability to get rid of toxins, including metals, on its own. But as far as synthetic chelators, I don't offer that. Including EDTA taken internally, I'm just not a fan of that either, Dr. Hall. So there you're going. Jay is saying, thank you for sharing your faith. The faith-based stuff is kind of new for me, Dr. Keith and I talk about this a lot, as again, my wife and I are good friends with Dr. Keith and his wife. And, I think it is very important to know that there is a creator who made us what we are, and the creator can also help us to heal. As long as we give the body what it needs, take away what it doesn't, the body is designed to heal. Nancy's saying, what do you suggest for a hydrocele? The hydrocele, is, again, various things can help with that. I would think that anything that would help with inflammation and oxidative stress is likely going to help to deal with a hydrocele. Jeff Jacobs, prayers directed me to NHD. Well, cool, man. I'm glad that you're here, Jeff, and appreciate you and all your support. All right, Dr. Keith, we told people 1 hour. We went to 1 hour and 10 minutes. Remember, you can email Dr. Smigiel at this location if you've got other, questions. You can schedule a consultation, a complimentary consultation with Dr. Smigiel, but just understand that it really is going to be reserved for the stuff that Dr. Smigiel does as a professional. Don't, he's not going to tell you what his favorite sauna is or the kind of cold plunge tub that he has. So just bear that in mind as well. And again, I hope that we provided a lot of value. There are people on here that there's just no way that they're going to invest in these type of therapies. Our intention was to let you know what they are, to provide you with the nutrition, the lifestyle, the mental wellness and mindset information, which pretty much everybody can do in one way, shape, or form, and then to have these other advanced therapies. So again, Dr. Keith Smigiel, thanks so much for being on with me on this presentation. And again, we wish you the best in cardiac longevity, vitality, mental clarity, all these things that we all really deserve. We are born to be healthy. The man-made poisonous lifestyle, and I'm blaming the men on this one, the man-made poisonous lifestyle has us in the position we're in, but thankfully there are some very high-tech biohacking strategies that can be very helpful. So again, for Dr. Keith Smigiel, I'm Dr. Jack Wolfson. Thank you again for your time. Replay will be available immediately afterwards, and we'll be sending out an email tomorrow. Have a great day.
Thank you.